This is Dr. Cordie. I have a functional medicine practice in Little Silver, New Jersey. And if you are pregnant and also have fibromyalgia, or you've been diagnosed with fibromyalgia prior to getting pregnant, you probably have a lot of concerns right now about how you're going to make it through this pregnancy. Pregnancy by itself is difficult. It's a lot of work. You're growing a little baby in there, and you have lots of good nutrition that you need to get in, on top of having a pain syndrome of fibromyalgia, which is usually also accompanied by some mood syndromes, so anxiety or depression, usually some bowel symptoms like IBS, constipation, diarrhea, and some sleeping problems. And we know that when you're pregnant, you get a little more tired because you have more work to do physiologically. So what do we do about all this? In my practice, we're going to start with some food sensitivity testing and nutrient deficiency testing. We want to make sure that the foods you're eating aren't making anything or everything worse. If you're constantly eating foods that are supposed to be good for you, let's say like spinach, but you're allergic to spinach, you're really sensitive to spinach, not so much allergic to it, but sensitive to it, we know that you're going to chronically have some inflammation that's going to make everything else worse. So the first thing we'll do is take a look at what foods you're sensitive to and remove them. Make sure you're on a good diet, individualized for you. The next thing we're going to do is look at your nutrient deficiencies and make sure that we're supplementing those. There are all these kind of standard prenatal multivitamins. What I find is a lot of women don't like those. They make them sick and throw up, and especially if you're in the first trimester and have a tendency to have morning sickness, you're already throwing up. So we don't need to make that any worse. So we need to get you on a good prenatal supplement program, hopefully from some really good whole food supplements. That's what we use in our practice. And then once we do that, we also want to make sure that you're doing things that you can do on a regular basis to help yourself, like some meditation practices that we can do that help progressively relax your muscles, progressively relax your nervous system, and help retrain your nervous system to be more calm. And of course, going into labor and delivery, we really want you more calm and feeling like you have control over the situation, because that always makes you feel better if you have more control over things and know how to do some progressive relaxation techniques or meditations that just feel good. The other thing I've found very effective during pregnancy is energy medicine techniques like Reiki, which is sort of a hands-on or a hands-off kind of energy movement healing. And I've also seen really good results with acupuncture. So we combine all of these things and make your pregnancy as comfortable and successful as possible, especially if you're going into pregnancy already having this fibromyalgia diagnosis, and then in the beginning of your pregnancy having fibromyalgia and first trimester exhaustion, fatigue, and maybe extra digestive upset during that first trimester with morning sickness. We can do as much as we can to help the digestive and the exhaustion symptoms get better with, again, really good food sensitivity testing, nutrient deficiency testing. So we know what you're sensitive to. We can cut that out so that doesn't make you worse digestively or exhaustion-wise. And then supplement your diet and the supplements you're maybe already taking with good supplements that will make sure to get through your pregnancy in a really healthy way. We know what you're deficient in, we know what you need more of, and then we know, based on, of course, basic supplements that you need during pregnancy, what you also need. And then once we put those things together, we can add in other energy medicine techniques and maybe some meditation to help get you through this pregnancy to be as successful as possible and painless as possible. Thank you.